Good morning. I'm Dr. Smith. Before we start, could you please confirm your name and age?
Yes, I'm Tom, and I'm 20 years old.
Thank you, Tom. I understand you haven't been feeling well. Can you tell me what symptoms you've been having?
I have a runny nose, blocked nose, itchy eyes, and I keep sneezing. I also cough sometimes and feel very tired.
That sounds really uncomfortable. When did these symptoms start? And do they happen at a certain time each year?
They usually come in early spring, but this year they are much worse than before.
I see. That must be frustrating for you. Based on the timing and your symptoms, it sounds like you may have hay fever. Have you heard of it before?
I've heard the name, but I don't really know what it is. Can you explain what hay fever is and why it happens?
Of course. Hay fever is an allergy. Your immune system reacts to things in the air, like pollen, even though they are harmless. This reaction causes a runny nose, sneezing, and itchy eyes. Does that make sense?
Yes, I think so. But why is it so bad this year?
That's a good question. You mentioned you moved recently. Can you tell me more about your new environment?
Yes. My new street is full of trees, and they produce a strange yellow spore.
That's very helpful information. Since your symptoms appear in early spring, it's very likely that tree pollen is the cause. Being around more trees means more pollen exposure.
Is there a way to be sure what I'm allergic to?
Yes, definitely. I can refer you to an allergy specialist for a skin prick test. This involves pricking small amounts of potential allergens into your skin. If you're allergic, a small raised bump will develop, similar to a mosquito bite. Would you like me to arrange that?
Yes, I would. Can hay fever be cured?
I'm afraid that we can't completely prevent or cure hay fever, which I know is disappointing to hear. However, the good news is that we can manage the symptoms very effectively.
What treatment options do I have?
I can prescribe a nasal corticosteroid spray to help with the inflammation and runny nose. I also recommend antihistamines, which work by blocking the chemicals released by your immune system that cause those uncomfortable symptoms. Does that sound like a good starting point?
Yes, please. I really want to feel better.
That's understandable. I'll prepare the prescription and the referral. Try to avoid pollen when possible, such as keeping windows closed. Do you have any other questions?
It's all clear, thank you.
You're very welcome. If you think of anything later, please don't hesitate to contact the clinic. Take care.